We need to break down the acronym, so that's the Centre for Health Equity Training, Research and Evaluation, and that essentially says what we do. So it's about intervening to address health inequities, and in southwest Sydney it's one of the most inequitable places in Australia, or regions in Australia. So we've had a relationship for about 20 years with the LHD and the university together, investing in CHETRE to address disadvantage across a number of programs. And currently we are part housed at Population Health, so we work closely with the Population Health Directorate and all the services within the Population Health Directorate. And at the university end we work closely, our sort of mothership is the Centre for Primary Healthcare and Equity that sits in the Faculty of Medicine. So I've been here for about 3 years now. Actually I was here 10 to 15 years ago, and then I came back 3 years ago. And since I've come back, we kind of have two bodies of work. So one is working very closely with population health to progress population health research with an equity and practice with an equity lens. And as part of that, we've helped the district develop what they call an equity framework, so a health equity framework, which is a kind of a statement about how the whole of the district needs to respond to health equity. We are responsible for the implementation of that. So we developed a toolkit to help services progress that, and we're working with cancer services at the moment and Fairfield Hospital as case studies to see how they implement that framework. And their work will hopefully inform others who want to go on and then implement the framework. Another good example of the work we've done is we've had a long-standing role down in Miller, which is a very disadvantaged community in southwest Sydney. And we've just completed our third round of a survey on the perceptions of life down in Miller from community members. And that's great because that's a really longitudinal piece of work that has been for around 15 years, different rounds of surveys to understand what's happening down in Miller. So I've got a fair bit of Category 1 funding through the NHMRC to focus on my personal work, which is around what we call healthy urban planning broadly. And I have, with the LHD as part of that, it's the kind of impact side of my work. So my research is very much focused nationally with partners around the country. But I then have influenced some of the practice of the LHD around healthy urban planning, like they have a unit here called the Healthy Places Unit. And I've supported them doing their work based on the findings of my other research. And things like also getting new types of positions up to focus on healthy urban planning across Western Sydney, of which this LHD is one of 3 really. So we've just got some a potential investment in a governance model supported by a healthy urban planning officer at the regional level, and that's based on a lot of my findings from my research. Another one that's important from a university LHD perspective is we were funded to, or regional perspective, is we were funded to, a colleague of mine from Western Sydney Uni and I were funded to focus on climate change in Western Sydney. So we've done a lot of work over the last 3 years helping local governments respond to climate change through developing guidance for them. We now are at a point when we're implementing that guidance with councils through the Western Sydney Health Alliance, which is a regional body. And then we've also got funding recently from the university, both universities, to focus on supporting heat in Western Sydney. And this is quite a long story, but I'll try and keep it short. There's a group of people led by a place called Wesrock, which is a regional, Western Sydney Regional Councils. And they have developed a really fantastic world-leading piece of work looking at developing a heat task force for Greater Sydney. And we are supporting that work, and I'm on the task force. And that connects in with both my funding from the university plus my funding from the NHMRC as well. So it brings it all together. And it's a really, from a kind of an innovation idea, that the way that we've had the relationship with the LHD for the last 20 years just demonstrates the effectiveness of having really high quality research, but also local application into practice. And we've managed to have a really great relationship across a number of domains where our expertise brings to bear on helping the LHD and the region really develop its approach to complex issues like climate change, like urban planning, early childhood, those kind of things. So my expertise is less around measuring things, more about doing things and implementing things. So that's why our focus on that work is around governance, because one of the challenges with urban heat is you can measure it till the death, but no one's going to do anything about it because it's a cross-government, a cross-sectoral policy issue. And that's where the work that we're doing is supporting both local councils, but also state government and even the federal government understand how it can, A, measure the risk properly, but also do something about that risk cross-sectorally, and that's where my expertise comes in. And it's interesting, the heat stuff, the heat kind of work's become the new obesity, because it's such an important thing that's going to hit the health service, and we need to do something about it urgently. So that work has both got support from across the local health districts in the region, but also other agencies, and it needs to shift into a kind of a statewide model of how we actually support addressing heat across different sectors, essentially. There's a whole heap of things, from mental health to if you've got an increased risk of cardiovascular complications, but really there's some fantastic work happening here around ED presentations, and we know that ED presentations spike during heat, and that's really the entry point for the district. And then from a population health perspective, my kind of role is, well, how do we engage with other sectors to deal with that at a population level, as well as the challenge of addressing increased ED presentations during those episodes.